folks, Steve Keene here, Bowtie Briefing for July 8th, 2016. The session's over, and that's good news. I want to cover 5 topics today, 1 or 2 of which you've heard before, but I want to give you the final status for 2016 on a number of items that have been of interest to us for a few months. First is the chapter, what we've referred to as the Chapter 58 protections for patients enrolled in Medicaid managed care programs. We were not able to get the clarification we were looking for from the General Assembly. There's a provision in the 2015 Medicaid reform legislation that generally applies all of the Chapter 58 protections for patients and providers to the Medicaid program, so long as the Secretary does not exclude them. There is some open discussion about which of those provisions will ultimately apply. We tried to get that clarified this year. That's an item for further conversation during the 2017 session. On a related topic, there were some enhancements to the provider-led entity section of the 2015 Medicaid reform law. Some clarification was made to allow risk-bearing entities to partner with providers. We were having some concern about the lack of activity on the provider-led entity side of the equation, and wanted to do some things to enhance that activity for between now and 2019. So those changes were made, and we feel very good about that. That's in Senate Bill 838, and you can take a look at that online. In another related item, you heard about this a couple of weeks ago, the clarification on what state insurance laws apply to the Next Gen group of ACOs that are working in the Medicare program. That is now law. That's House Bill 287. It's a provision in House Bill 287. And I encourage you to take a look at that if you or an entity that you're working with is considering involvement in the Next Gen program for Medicare. The next issue I want to address is House Bill 728, the medical board changes. As you know, we've been working on these changes for 4 years together with a small coalition of other entities, including the medical board and the PHEP program. Some important changes are in House Bill 728, including provisions to make sure the medical board has sufficient revenue to carry out its responsibilities to the public and to the medical community by way of a registration fee increase from $175 to $250 per year. There is an absolute lifetime limit on the number of months that a physician can serve as a member of the North Carolina Medical Board. And there are important provisions in there to limit the use of maintenance of certification in licensing decisions and to make sure that physicians who are involved with PHEP have access to the assessment and evaluations that are done of them as part of that program. The final issue is the controlled substances reporting system. Some improvements were included in House Bill 1030, which is the budget that fund some important software enhancements to the CSRS, allowing it to talk to adjoining states, making sure that it is interoperable with the Health Information Exchange, and requiring every physician and other provider who is entitled to, by virtue of their license, to write prescriptions for controlled substances to register with the CSRS. We believe in the long run those changes will be significant enhancements to get at the problem of opioid abuse and poisoning in North Carolina. And that's it for this week. Thanks for tuning in, and look in the coming weeks for some programming now that the session is over related to the Medicaid reform law that is being implemented in North Carolina between now and 2019. Thank you.